Hello. In this video I would like to explain how you can use a case analysis and group work as an experiential learning method to contribute to profound reflection during nursing or midwifery care in a specific clinical situation. During this experiential learning method, participants can get into the role as a caregiver and care receiver. They are confronted with several specific clinical situations that need action with ethical decision. Students cooperate in small groups, reflect on cases, and answer questions prepared by teacher. When finished, students share results of their work with other group using poster method, seeking feedback of the rest students. In order to carry out this teaching method, it's necessary to prepare materials for participants in the field of ethical concepts, patients' rights, and the code of professional ethics. The main and basic assumption can be explained in a short introductory lecture. In addition, it's necessary to prepare a room and the necessary tools, in which participants will have space for a thorough case analysis and preparation of posters. During the first meeting, remember to allow the participants to build a relationship based on trust. You need to give them time and space to get to know each other. Then the participants are divided into a group of 4 or 5 people. Choose a group leader who is to draw one case and coordinate the work of the group. Each case includes a brief description of a specific clinical situation that requires interaction with the patient, family, and other members of the therapeutic team. Students group work together on their case. They reflect and discuss values engaged, ethical principles that may be followed, norm indicated by code of ethics, patients' rights. Students' aim is to answer all questions added to case and justify their answers with ethical knowledge. Students may use notes from lectures and materials based on the list of references given earlier. Teachers support students' work, mentors their reflection and discussion, answer questions that may appear. The teacher moderates the discussion. On the slides there are few examples of the questions. These questions are helpful in reflecting and discussing a specific clinical case. For example, what ethical issues are involved in your case? What norm of code of ethics for nurses, midwives should be applied in this case? What is the role of nurse, midwife in this specific case? Please note that depending on the course of the discussion and reflection, the teacher may suggest other questions that may help in a specific case. Each student's group prepare poster describing the case, its merit and solution with ethical decision making to share with other students' group. When all groups are ready, each group in established order present their posters, starting with reading the case to make others aware about the issue, and the discussion is moderated by teacher with all students regarding each case summarizing decision made. Work with cases describing clinical situations that may involve conflicts of values and ethical problems help students to be more sensitive to ethical issues in practice. Discussing different options of solution when answering the questions added to case helps students to use their ethical knowledge in more practical way. Sharing their work with others during posters presentation and also students' work in groups develop their cooperation with others, openness to different perspectives, negotiation of solution, respect to each other. We encourage you to writing and oral evaluation of this method. You can use some questions regarding ethical concepts, principles, norms and patients' rights, which were used in work on cases. On this slide, you can see the reflections that students had after the classes. Thank you very much for watching this presentation. This tool has been created by Medical University of Lublin in Poland on behalf of the ETHCOM project consortium. We wish you good luck.